In this video, we will train you on the proper use of the HoverMatt Single-Patient Use Link, including how to transfer a patient, boost a patient with one caregiver, reposition a patient with one caregiver, turn a patient with one caregiver and multiple caregivers. The air supply inflates the HoverMatt SPU link to cushion and cradle the patient. At the same time, air escapes from thousands of holes on the bottom of the HoverMatt SPU link to reduce friction and the force needed to move the patient, making the patient handling tasks easier. The HoverMatt has a weight limit of 1,200 pounds. Different sizes are available to accommodate a variety of patients. The HoverMatt SPU link is radiolucent and artifact-free. It's also latex-free. The HoverMatt SPU link is designed with a tapered head to accommodate narrow diagnostic imaging, stretchers, or stretcher chairs. There are two patient straps that provide a sense of security and visual comfort for the patient and caregiver. Ensure that the patient straps are secured loosely for lateral transfers and that the straps are not tight against the patient's body during and after mattress inflation. The HoverMatt SPU link has 8 handles, 4 on each side. The handle design ensures that the caregivers always remain close to the patient for safety. The handles are color-coded for easy-sized identification. There are 2 hose air intakes, one on either side at the foot end to facilitate efficient patient mattress inflation. The label on the HoverMatt SPU link indicates the foot end and top. To ensure the proper patient placement, the top and bottom of the HoverMatt are made of color contrasting material. Now we will demonstrate how to laterally transfer a patient using the HoverMatt SPU link. A minimum of 2 caregivers is necessary. If the HoverMatt SPU link is not already on the bed or stretcher, place it underneath the patient by using the log roll technique. Please see the acute care video for log rolling technique. If the patient is already positioned on the HoverMatt SPU link, remove the link straps from the bed frame. Ensure that the patient's straps are tucked away but remain visible for easy access. Ensure the patient is centered on the HoverMatt SPU link with their head 2 inches down from the top edge. Then loosely attach both patient straps around the patient prior to inflation. Ensure the transfer surfaces are as close together as possible, confirming wheels are locked. Transfer from a higher surface to a lower surface, approximately 1 to 3 inches difference whenever possible. With the air supply cord plugged into an electrical outlet, insert the hose at a slight angle into one of the intake valves. One caregiver should be positioned next to the patient before the air supply is turned on. This caregiver should inform the patient of the task and explain what the patient will hear and feel. Inform the other caregiver that it is safe to start the air supply. When the HoverMatt is fully inflated, the caregiver on the sending side should begin the transfer by pushing the HoverMatt SPU link at an angle, feet first, towards the receiving caregiver. It's recommended that receiving caregivers grasp the handles with their palms facing up. This reduces unnecessary reaching by the receiving caregiver and promotes good ergonomic positioning. When the patient has been fully transferred to the receiving surface, the caregiver beside the stretcher should remain next to the patient with their body against the HoverMatt SPU link and their hands on the handles. The other caregiver should ensure the patient is centered on the receiving surface by performing a visual check at the foot end of the stretcher. Move the HoverMatt SPU link to center the patient on the receiving surface as needed. The caregiver at the sending side will turn off the airflow of the air supply by pressing the standby button. Then raise the side rails and remove the patient straps. The air supply hose may be unsnapped and removed. The HoverMatt SPU link can remain under the patient and be used for all-day care. If the patient and HoverMatt SPU link slide down in bed, a boosting technique can be used to reposition the patient back towards the head end of the bed. The side rail must be raised on the opposite side of the caregiver. Insert the air supply hose into the air intake valve. The caregiver turns on the air supply using the appropriate button for the size of the product being used. With the HoverMatt SPU link fully inflated, the caregiver will grasp the handles closest to the direction they are boosting and slide the HoverMatt SPU link to the desired location. Once the patient has been repositioned in bed, press the standby button to stop the airflow. Remove the air supply hose if this is your last task and raise the bed side rail. Adjust link straps appropriately. If the patient becomes off-center on the HoverMatt SPU link, you can reposition the patient using this method. The side rail must be raised on the opposite side with one caregiver. Insert the air supply hose into the air intake valve. The caregiver initiates airflow by pressing the appropriate button for the product being used. For this technique, the caregiver's non-dominant hand should be in position palm side down on the inflated HoverMatt SPU link next to the patient's shoulder. Press down on the HoverMatt to create an air pocket. Then the caregiver will slide their dominant hand, palm up, under the patient's upper back so the palm cradles the patient's scapular region furthermost from the caregiver. To reposition the patient, the caregiver should press down on the inflated HoverMatt SPU link to reinforce the air pocket, while the hand under the patient's scapular area slides the patient towards the caregiver's body until the patient is recentered. Repeat this process until the patient is fully centered. The patient's legs can then be manually realigned with the rest of the patient's body. To turn a patient with one caregiver, you can utilize a portable or ceiling lift. If using one caregiver for these tasks, the side rail must be raised on the opposite side. Remove the link straps. Insert the air supply hose into the air intake valve. The caregiver initiates airflow by pressing the appropriate button for the product being used. With the HoverMatt SPU link fully inflated, slide the patient to the edge of the bed. Ensure the patient is secure, then press the standby button to stop airflow. Disconnect the hose from the HoverMatt SPU link. Using a 2-point or 4-point hanger bar, attach the middle two handles to the hanger bar. Ensure the connection is secure. Use the lift to initiate the turn of the HoverMatt SPU link to the desired height. Once raised, wedges can be placed under the patient. Lower the HoverMatt SPU link and remove the handles from the hanger bar. Place a pillow between the knees and under the patient's head for comfort. To turn a patient, ensure the patient is centered on the HoverMatt SPU link and the link straps are detached. Insert the air supply hose into the air intake valve on the opposite side of the turn direction. Inform the patient of the task. Initiate airflow by selecting the appropriate button for the size of the product being used. With the HoverMatt SPU link fully inflated, slide the patient in the opposite direction of the turn and as close to the rails as possible to ensure the patient is centered on the bed following the turn. To turn the patient on their side, the caregiver on the side the patient is turning toward will gently push down on the HoverMatt SPU link at the patient's shoulder and hip, while the second caregiver pulls palms up on the HoverMatt SPU link handles. Once the patient is turned on their side, the caregiver receiving the patient will stay with the patient, while the second caregiver presses the standby button to stop airflow and place wedges as desired. Lower the patient onto the wedges. Ensure the patient's straps are not underneath the patient. Check the wedge placement by placing your hand between the wedges, confirming the sacrum is not touching the bed. Please see the additional videos for information on using the HoverMatt SPU link for other patient handling tasks and techniques.